Good. You know, I hope we recognize what an amazing day it is for Utah. For the first time in my recollection, we have 3 top officials, cabinet members from the federal government in Utah meeting with state leaders. Thank you, Senator Kennedy, Administrator Zeldin. Thank you so much for your time coming to Utah. We had Secretary Duffy here as well from the Department of Transportation. What an honor and what an incredible opportunity for the state of Utah. Utah is leading the way in making America healthy again. Because while other states are just talking about the solutions, Utah is actually implementing and creating the solutions. I'm so proud to be standing here today alongside of Secretary Kennedy, Administrator Zeldin, and my legislative colleagues to celebrate Utah's landmark proposals that reinforce that Utah's position as the best state in the nation and to ensure that future generations grow up stronger and healthier. We're excited to recognize Utah's bold measures to ban supplemental fluoride in our drinking water, prohibit soda purchases with SNAP, and remove synthetic food dyes from the lunches in our public schools. We're not afraid to lead on these issues, even though they are very controversial in some circumstances. We know that when Utah leads, other states will follow. Secretary Kennedy talked about that a moment ago in our roundtable. States are the laboratory of democracy, and we're excited to be leading out on so many fronts here in the state of Utah. When we focus on real solutions and work together, we can make a difference not just for our state, but for America in making it healthier and stronger and prosperous once again. We're looking forward to working alongside with this administration and Secretary Kennedy to bring real change into our schools, into our homes, and into our communities. So with that, we're going to go ahead and kick off the press conference and get it started. We'll first hear from Representative Grecius, who's been a champion for empowering Utah families and promoting health freedom. She's the one that sponsored the fluoride bill. Then we'll have the opportunity to hear from Representative Kristen Chevrier, who has been a strong advocate for nutrition and well-being of our children, who sponsored the SNAP bill as well as the school lunch bill. Then we'll turn the time over to Secretary Kennedy, whose leadership on a national level highlights what so many people have had concerns with over the years and helps drive these discussions from just conversations into actions. Finally, we'll conclude with Administrator Zeldin, who has been instrumental in crafting reasonable solutions to protect American families. And then at the end, we'll have time for a few questions. So with that, Representative Grecius.
Thank you all so much for being here today. This past legislative session, I was proud to sponsor HB 81 fluoride amendments, a straightforward and simple bill that prioritizes personal choice and expands medical freedom for Utah's residents. First, the bill ensures that fluoride is no longer added to our public water systems. This means that every individual and family will have the freedom to choose for themselves whether to consume supplemental fluoride, rather than having it be automatically included in our public drinking water. Second, the bill expands access to fluoride for those who do want it by allowing pharmacists across the state to prescribe fluoride supplements. This approach enables Utahns to receive fluoride in a manner that takes into account proper dosage as well as personal health needs, rather than a one-size-fits-all. This is the type of common sense policy that makes Utah the greatest state in the nation. We empower individuals to choose what they put into their bodies while fulfilling the proper role of government. I'm so proud of Utah for taking this step forward, and I sincerely appreciate the support and the thoughtful conversations that made it happen. Thank you.
As the sponsor of HB 402 food additives in schools and HB 403 SNAP funds amendments, I want to thank leadership, my floor sponsors, my colleagues, parents and concerned citizens, and the governor for their support in passing this legislation, and U.S. Senator Mike Lee and Congressman Mike Kennedy for taking this legislation to the federal level, and Secretary Kennedy for taking time to celebrate our efforts. Secretary Kennedy and I have been fighting for decades for the health of Americans. Utah was the first to require a waiver to be submitted, and the first to require the removal of harmful synthetic dyes and other chemical additives from our school-prepared food. Removing harmful ingredients and returning to real food will help ensure that our children receive the nutrition that they both need and deserve. It will improve physical and mental health, increase academic performance, and decrease behavioral issues in our schools. Removing soda from SNAP funding is a benefit both to the overall health of our state and to taxpayers whose dollars were meant to be spent on keeping our most vulnerable neighbors alive and well. This legislation is about physical health, financial health, stewardship, and leadership. We anticipate that this is the beginning of a cultural shift that will extend throughout the nation, a shift toward proactively building health rather than treating disease. Thank you.
Thank you very much. I want to thank all these extraordinary legislators, and I also want to thank Governor Cox, who is, I'll thank him in absentia for his leadership on this issue. I'm very proud of Utah. It has emerged as the leader in making America healthy again. We have a public health crisis now in our country like nothing that we've ever seen before. When my uncle was president, I was a 10-year-old boy, 3% of Americans had chronic disease. Today, 60%. We spent zero on chronic disease when I was a boy, and today we spend 1.3 trillion. Diabetes was virtually unknown in children, juvenile diabetes. When I was a little kid, the average pediatrician would see a single case in his lifetime over a 40 or 50-year career. Today, 1 out of every 3 kids, more than that, 38% of our kids, of our teens, are now pre-diabetic or diabetic. And 74% of Americans are obese or overweight. About the same number, 74% of American kids cannot qualify for military service. We're seeing a crisis in mental health that is linked in some way to our foods. We're seeing crises in fertility. A teenager today, an American teenager, has less testosterone than a 68-year-old man. We're seeing sperm counts drop to 50% of historical rates. Girls in our country are reaching puberty 6 years early, 10 to 13 years old. We're seeing an explosion of cancers, including, we talked just recently about colorectal cancers, which were never occurred in young people. And now we're seeing kids in their teens with colorectal cancer, and it's exploding. Oh, if we want to be a moral nation, if we want to maintain our moral authority around the world, our chief obligation is to our children, and we're letting them down. And I'm very, very happy that Utah is taking the lead in so many ways. In one of the first states in the country to restrict cell phone use in schools. They've now cleaned the chemical additives out of the school lunch program. They've applied for a SNAP waiver to get rid of sodas on SNAP, which I know Brooke Rollins is about to sign, and they've led the nation in banning fluoride. Fluoride should not be in our water. Fluoride had a strong justification in the 1940s when it was added, and people didn't understand the science, and they thought its benefit to our teeth was systemic. And by drinking it, it would enter your body and somehow protect your teeth. Now we know that there is no systemic advantage, zero systemic advantage, and that the only advantage comes from topical application. So it's the water that passes through your mouth. You can achieve that benefit from brushing your teeth. And in the era of fluoridated toothpastes and mouthwashes, it makes no sense to have fluoride in our water. The evidence against fluoride is overwhelming. In animals, in animal models, and in human models, we know that it causes IQ loss, profound IQ loss, and it's dose-related. So the more fluoride you get, the higher levels in your drinking water, your urine, the more likely it is you will lose IQ and also other neurological injuries like ADHD. It affects, science indicates that it affects kidney health, it affects liver health, and it causes hypothyroidism, it causes osteoarthritis. Women who are more exposed have up to 50% more hip fractures than women who are unexposed. It causes fluoridasis in between 40 and 80% of our kids. It makes no sense to have in our water supply. And I'm very, very proud of this state for being the first state to ban it, and I hope many more will come. I now want to introduce EPA Secretary Dr. Lee Zeldin.
I appreciate everyone from the media who's here, and I would ask you to feel the passion of so many who are in attendance here. There are times where we do a press conference on an issue and the media is attending, sometimes others. But as I'm taking in this press conference and I'm looking around this room, you could tell how much fight, how much effort, how much passion is filling this room that we're in. For all of the Utah leaders who are here, who are serving at the State House, thank you for being an example, leaders, champions, really for the rest of the country to follow. This type of leadership is needed for America's families, for America's children. And it is an honor to be here with all of you and to be part of the Make America Healthy Again Commission led by Secretary Kennedy. As soon as I was nominated by President Trump as administrator of the EPA, the Secretary instantly reached out to start talking about issues that he is so passionate about. And number one on that list was fluoride. And I was waiting during my confirmation hearing for one of the Senate EPW members to ask me, so how many times, by the way, has the Secretary nominee Bobby Kennedy reached out to you about issues that he's passionate about? And the answer would have been a lot. When we met in my office, number one on the list was fluoride. And we're here today, EPA is here today to make an announcement that wouldn't be happening if not for Secretary Kennedy. So the current standard for EPA is 4 milligrams per liter of fluoride. And it was most recently reviewed July of 2024. But a lot has happened since July of 2024, including a national toxicology program report in August of 2024. If you ask if any members of the media wanted to quiz Secretary Kennedy on every aspect of science that is out there on fluoride, he is ready for any question that you have for him. He's read all of the studies, he's memorized them, and he's fighting for them. So what EPA is going to do is go back and look at these studies that have come out since July of 2024, and we're prepared to act based on these science, both the National Toxicology Program study, as well as other peer-reviewed studies. If this is as important as it is to Secretary Kennedy, if it's as important as it is clearly to so many people who are here in this room at this press conference today, then it is top of the list for the Environmental Protection Agency. Secretary Kennedy, we wouldn't be doing it without you. It's an honor to be here, and it's a privilege to be with all of the leaders who are here fighting for Utah families, fighting for Utah's children.
Wow, what an announcement. We look forward to that. Thank you, thank you, thank you. I'd be remiss if I didn't just recognize we have some great experts leading not just Utah, but the nation with University of Utah Health Department here, as well as IHC, representative from Intermountain Healthcare, who Utah's been nationally known to have the best healthcare system in the nation. And so we're grateful for all that they do for the state of Utah. Before we open it up to a few questions, I just want to reiterate my appreciation to Secretary Kennedy, Administrator Zeldin, for both visiting the greatest state in the nation, but more importantly, your leadership in the country. And so we're very excited to work alongside you as the state of Utah to help further the great work that you all are doing. Thank you. One thing that we know, Utah handles its affairs better than any other state in the nation. You go down the list, Utah is one of the best, most fiscally sound state in the nation. We have the best economy in the nation. We're the best state to start a business right here in the state of Utah. And so many opportunities. #1 state in the nation for upward mobility. So many great things. One thing we'd like to do, and the request has been made, and I've been so excited to hear the response back from both the administrator and the secretary, but we'd like to stand as a national experiment, allowing us to keep, the state of Utah, to keep some of its federal dollars and tax dollars and run some programs, run the programs. We want to be a pilot project, help discontinue the federal oversight, whether it's education, transportation, Medicaid, public health, public lands. We manage more effectively, more efficiently, and more affordably than the federal government, certainly, but more so than any other state in the nation. Sign us up, please. We are short on time, but we do have have a little bit of time for a couple questions. So with that, let's open it up to a couple questions. Let's go with Ben Winslow.
Mr. Secretary, you've heard from the Speaker about asking to manage federal programs. Are there any that you are amenable to letting the state control?
President Trump's vision for this country is that the states should be 50 laboratories around the country, that they should be able to run their own affairs, and that we can that the best ideas are coming from the grassroots and are coming from the bottom up. We are determined to do that. And we're talking about doing it already, and we're going to move very quickly.
Thank you.
You said a few days ago that HHS was going to be reinstating some jobs that were cut. Your staff had said that's not happening. Can you clarify? Is it? Are there programs that you believe should be reinstated?
No, the program. What I said was that the programs have been consolidated. So we didn't cut any core programs or any critical care programs or any scientific programs. Those programs are being consolidated in a new agency that is going to make America healthy again.
So let's move on to another question. Amy, with Deseret News.
Yes, Mr. Kennedy, I'm curious about the evolution of your opinions on fluoride. Is it something that you've always advanced, or did it evolve over the years? And what led you
It evolved when I read the science. I think I read it most carefully in the last couple of years, and the science evolved. The National Toxicity Program issued its report in August, and that report was devastating. And I don't think, I think we need to apply the precautionary principle in this country that we should do no harm, and it clearly is doing harm. I mean, the trade-off is IQ loss in kids, and we can't afford that. In this country, we need all the brain power that we can to handle the challenges of the future. And then the other health impacts, which are less clearly documented in the science because they have not been completely well studied, but they are alarming enough so that we shouldn't be demanding that parents accept something for their children in their homes that is essentially a medication. They can go to the drugstore and they can get toothpaste. If you want to apply it in your home, you can. You can get mouthwash. And I believe, and I think it's a moral imperative that we all believe in freedom of choice in this country. It is one of the bedrock principles of our democracy that the government shouldn't be making decisions, intimate decisions about our own lives. And, and then just the science is overwhelming on it. Now, it doesn't make any sense.
So, Amy, I'd maybe just like to add to that, Amy. In Utah, we believe here in win-win solutions, right? So part of Representative Grecius's bill actually made it easier to get prescriptions for fluoride. And so for those parents, we want to make sure that those options are there. And so appreciate Representative Grecius's leadership on that. Let's go with one more questions with the national news media. News Nation. Where's News Nation? Right here. Yes.
Secretary, if you got of which, in all 50 states got rid of fluoride from the drinking water, how healthy would America look after it? What would it look like to you if you got every single state to do that? Secondly, are you concerned with the speed at which you're moving on something like this issue here? People we talk to believe that there are higher priority issues here that you could address.
Well, we're addressing a lot of issues. I mean, we're making press announcements every day. In Europe, most of the nations have already banned fluoride, and their cavities have not increased. And there's no way to measure without some kind of observational study an increase in IQ until many years down the road. When the indicators are that fluoride damages IQ in the same way that leaded gasoline, at about the same level it does. And we saw about a 2-point IQ nationally, a 2-point IQ hike after about 20 years after the ban on leaded gasoline. We will see a difference, and people will be healthier.
Bobby, can I ask a question, please? The Alliance for Natural Health has sued the FDA to re-implement the CPG 400.400 to regulate homeopathic medicines since the Food, Drug, and Cosmetic Act of 1938. And I wondered if you've seen that suit, if you would acquiesce and not fight it, because regulation for natural medicine.
Who have they sued?
The FDA, the Alliance for Natural Health.
I will talk to Marty McCary. Marty McCary is a very, very big advocate of natural medicine and making sure that we have science-based medicine for everybody, whether it's natural or allopathic.
So I'm just going to follow up really quick. And we're here talking about fluoride. But one thing the Trump administration has shown, and these administrators have shown, that they can walk and chew gum at the same time. We're talking about fluoride, but there's a whole host of other things that they are working on. We're very grateful for your leadership and all that you guys do. Thank you so much for coming to Utah. Thank you all for being here today. We're going to wrap up. There's all we have last time, so thank you.